Wonderful. Hello, everyone, and thank you for attending today's Housing and Security Learning Cohort webinar. My name is Alex Lewins-Wordling, and I am working with Root Cause on this year's Learning Cohort series. We're thrilled to have all of you participate and have with us today two wonderful presenters who I'll soon introduce. Following today's presentation, we will continue the conversation via ForumD, our online platform that Root Cause is using to share thoughts, perspectives, and resources on these topics. If you need any help logging into ForumD, please contact me or any of the Root Cause staff members. Just a couple of quick notes in terms of housekeeping. Today's speakers will present for about the first 45 minutes, and then we'll leave some time for Q&A. If you have a question, please enter it into the chat box within the GoToWebinar platform, and I will field the questions as they come in. You do not need to wait until the end of the presentation to add your question. Also, following today's presentation, you'll receive an email from Root Cause with a link to a short survey to provide your feedback. So thanks in advance for taking a few minutes to complete it. And as always, we encourage you to be an active participant on the ForumD site. Finally, today's webinar will also be recorded and posted on the forum site within the week. So now I'd like to introduce our two speakers. Our first speaker is Kendra Smith, the Director of Social Determinants of Health at ProMedica, a mission-based non-for-profit integrated healthcare organization headquartered in Toledo, Ohio. It serves communities in 30 states across the nation. With wide-ranging experience in real estate development, urban planning, housing policy, and community organizing, Kendra is working to improve health outcomes system-wide by advancing ProMedica's commitment to improving the quality of life for residents and investing in the neighborhoods and communities within the ProMedica footprint. Prior to joining ProMedica, Kendra served as Executive Director of Preferred Properties in Toledo and is the Senior Housing Planner for the Chicago Metropolitan Agency for Planning. Our second speaker is Kelly Bruno. Kelly is the President and CEO of the National Health Foundation, a community-based nonprofit where she leads a team that works to address community needs by developing and implementing innovative systemic solutions to gaps in the healthcare delivery system. In the last 2 years, the organization has narrowed its focus to address the health issues of underserved communities with a priority on social determinants of health and transition experiences in the healthcare system. Prior to her role as CEO, Kelly served as the COO and Vice President of Programs. In those positions, she was responsible for designing and implementing programs that focus on healthcare delivery change, healthcare system delivery change, and ensuring the uninsured. And with that, I will turn the presentation over to Kendra.
Great, thank you so much, Alex. Everyone, thank you for joining us. I'm really excited for the dialogue today. So really just kind of wanted to hop in and start, and we can advance to the first slide, please. Why a healthcare system would even think about housing and all of the other social determinants. And so I'm sure this slide is familiar to many folks, but what we know is that 80% of someone's health and well-being actually has nothing to do with the healthcare that they receive. And so when we think about our communities and where folks are going home to at night, their education, their job situation, their access to foods and services and goods, all of those have an impact on someone's physical health. So as a health system, we are seeing folks walk through our doors with many times just layered health needs that really, if we took some time to think about their living conditions, their everyday life outside of our clinical space, we have some opportunity to improve that before they even get to our doors. And so as a system, we really said, how do we interact and what spaces do we to join in with the community and partner to be able to really affect change in this space. And so social determinants of health is a huge platform for us. It's part of our strategic plan and something that we are committed to, and housing is just one piece of that. Next slide, please. And so ProMedica functions under what we call our anchor mission strategy. And so for us to be headquartered in Toledo with a footprint that covers 30 states, it's really important for us to think about not just how are we delivering the best care, healthcare possible, but how are we supporting the communities in which we serve. So this roadmap highlights our journey. We started 10 years ago addressing social determinants through food, and that has evolved many different ways to our food as prescription program, to our food clinic. We own and operate a nonprofit grocery store, being a catalyst for community investment, to now having a dedicated social determinants of health team that looks at both community and clinical integration and really merges that in our research and data team. And so really excited to have this platform internally that allows us to support communities. Next slide, please. So one of the other things that we think about as we look at Toledo, and so this map represents Toledo, what are we experiencing? What are our patients coming to us with? What are we seeing in communities? And so this map highlights life expectancy gaps. So if you look at to the top left corner, 43560, 82.7 years, that zip code and that location is one of our Metro Toledo hospitals, Flower Hospital. And if you look on the opposite end into the bottom right corner, 43604, Uptown Neighborhood, which is the neighborhood where we run our social determinants of health place-based pilot, you'll see that differential. And in reality, those two zip codes are less than 10 miles apart. And so when we think about the why of this work, this slide highlights the why, and now our team is really tasked with figuring out the how. Next slide, please. And so when we think about Toledo, which has really been our pilot area, you'll see that, again, the Uptown neighborhood, that zip code we just mentioned, is adjacent to our downtown core. So our corporate headquarters are in the downtown core. And so as an anchor institution, how do you implement an anchor mission? And so today we're going to talk a little bit about how we've built capacity around housing space for both our team, for the system, and the community. Next slide. So our first piece of this was to create a framework that allowed us to look at social determinants of health as a comprehensive community issue. And so we launched what we call our ProMedica eBite Neighborhood Promise. This is a 10-year, $50 million initiative committed to neighborhood revitalization in Central City, Toledo. We have started the Uptown neighborhood is our first pilot neighborhood in this. In 2020, we'll actually be moving to 2 other neighborhoods. But this says, if you take the time to invest in place long-term and do that in the social determinant areas, so we look at health, housing, workforce development and financial stability, commercial corridor development, arts and culture, safety and beautification, education. If you look at all of these things together, what ability do we have to improve quality of life as well as health and well-being? And how do these investments have the ability to move the needle on someone's improved health care? And so we operate this program through our community-based team in collaboration with existing community partners, existing programs, residents that are in the community, stakeholders in the community, and say, tell us what's working, what is not working, what does the capacity look like here, where do the gaps exist? And then our team's goal is to be able to fill in those gaps, to help build capacity, to support residents, to help them implement their vision for their neighborhood, and be able to tie that back into health outcomes to make the case that investment in social determinants is really the pathway that health systems should be taking across the board. Next slide, please. So when we think about building our capacity in this space, it's great to say we want to support existing organizations and that we want to support existing initiatives. But the reality is there were gaps that existed in this neighborhood. And so the first thing that we knew was that this neighborhood was an identified food desert. And so what you see here on your screen is really our first attempt to implement our place-based strategy. So the eBite Center is a 4-story building in the core of the Uptown neighborhood. And in 2014, we said, well, we have this building, let's take this opportunity to address the biggest issue that we're hearing about in the neighborhood, which is being a food desert. And so worked with our local grocery partners to say, this is what we'd like to accomplish. This is what we would like to do. And everyone was on board with the concept. But in a neighborhood of 1,900 people, it was not feasible for them to own and operate a grocery store in this space. So the system opened Market on the Green in 2015 as a nonprofit grocery store. We own and operate this space today. The rest of the building houses a teaching kitchen where we host classes on how to use fresh produce and product from the grocery store. It also has our Financial Opportunity Center, which is our one-to-one financial coaching model, which is a partnership of the Local Initiative Support Corporation, our Community Care Hub team, which is our team of social workers, nurse navigators, community health workers are on this team. There are computer labs in this space. We host an STNA training program in this space, and so we really wanted this to be a hub in the community where we could fill programming gaps, listen to what the community was telling us that they needed, and be able to implement this. And so the hub of our place-based work is really tied to the eBide Center and the programs and activities and partnerships that we cultivate in this space. Next slide, please. So when we think about a neighborhood and we think about making housing investments, this is the Uptown neighborhood on paper, and you can see these struggles and the challenges in the neighborhood are familiar to people across the country, right? So many of us work for nonprofit organizations or healthcare systems or other entities that are seeing these same stats in communities across the country. And when you add in the health disparity on top of everything else that you see, we really have to start thinking differently on how we invest in communities and how we're helping people solve these issues before they make it to us in the clinical space. Next slide. So the first space where we really had to build capacity before we could even jump into housing projects, which was an identified need in both the 2013 and the 2019 community plans for the Uptown neighborhood, was resident engagement. ProMedica does not have a clinical facility in this neighborhood. Folks know that our headquarters is close by, but we had an uphill battle on how to build trust in a community where we did not have a day-to-day presence prior to the grocery store opening in 2015. And so for us, it was really important to form partnerships with organizations and folks that had established themselves in the neighborhood, that had done work, that had aligning missions, that could support us in the work around social determinants, but we could also support them in the work that they were doing. So in this neighborhood, we operate a creative placemaking model with the Arts Commission of Greater Toledo, which is the 1% for Arts organization for our community. And we really say we want to engage folks, and we would love to hear, how they're utilizing healthcare and what their access looks like. But more importantly, we want to know how they're functioning in their space, and we want to be able to do that through social opportunities. And so when we go out into the community, very rarely, over the past year was our first interaction talking to anybody about healthcare. We made a commitment to not use surveys, to not have clipboards, to not just go in and ask folks questions. Instead, we were hosting food truck rallies in the park that's next door to eBide Center. We were hosting mural painting opportunities and biking outings and different things to just get people out and socializing amongst their neighbors, but also with us as organizations in the neighborhood. And so when you think about building capacity for your team where it doesn't exist, building partnerships that help you get there are part of the battle. And so even if folks are not comfortable sharing with ProMedica, there are a slew of other organizations in this engagement space with us that they do have comfort with, that they do utilize on a consistent basis, that they do know the staff as they get to learn the ProMedica team. And so this was really our first capacity building exercise, was how are we engaging with the community in a space, and with any good place-based project or process or exploratory process, a necessary step for really that folks should be undertaking. Next slide, please. Our next capacity building opportunity really came from what had already existed in the neighborhood, what conversations were happening before ProMedica came into the space, before the grocery store opened. And for that, we really had to take a step back and do our research and due diligence. And so, as I mentioned, 2013 was the first neighborhood plan that was created in the Uptown neighborhood with an update that was completed in 2019. Downtown Toledo had completed a plan in 2017 for the Central Business District and downtown, which Uptown is a part. And so we had to review that plan and go back to not just a participant in that process, but also hear what other folks were saying. There is an arts and culture plan that overlays the neighborhood. What does the city have planned? What does the county have planned? What are resident groups doing? And so we really had to do our due diligence before we even entered the space. And so when you think about timeline and how fast we're trying to move through and gaining trust and having knowledge and doing your due diligence, another space where we had to build capacity. One, most of these plans don't explicitly mention healthcare. And so while healthcare is our expertise, because we know that all of these other factors influence healthcare and health delivery, we had to really get up to speed on a lot of topics that are maybe not traditionally always discussed in a healthcare setting. And so we're really grateful to be able to participate in all of these plans, but also then to really use them as a roadmap as we make decisions about community investment, about which partnerships we're missing, and really what our priorities should be. Next slide. The other capacity building opportunity that we had in the housing space was to really be able to evaluate existing tools and what tools were missing. And so as you've been following the health and housing space, a lot of hospitals are making investments in housing opportunities, which are fantastic. Many of them are doing them through LIHTC, low income housing tax credit projects, which is amazing and a great opportunity for so many markets. The Toledo market, for a little bit of time, has traditionally struggled in the LIHTC allocation space. And even once projects are allocated, having issue getting those projects to year 15 successfully, not to mention thinking about what happens next. And so ProMedica really knew that if we wanted to make a housing investment again, what is not just the market telling us can be successful, but what are our partners telling us can be successful? What are constituents telling us can be successful? And so for us, having a handle on different types of tools as you think about LIHTC and new market tax credits and all of these things that were available to us, but also knowing that we had to push ourselves a little bit to think differently. And so for us, one of the first steps was to create this ProMedica List Health Impact Fund. So we knew that we had a lot of projects and a lot of things in our pipeline that, to look at a capital stack, to look at a feasibility study, were just not quite there. And we needed a partner that was going to be able to help us get some of these projects over the hump. So we partnered with LISC to do a $25 million loan pool that really focuses on housing development and small business development, knowing that those two items have the opportunity to go hand in hand. And really said for our folks that, maybe this is their first project, maybe they're not quite conventionally banked because they're too far extended on a previous project. How do we get them connected to really make great investments in our community, but that having a little bit of non-traditional financial need should it be a barrier? And so we've partnered with LISC. You can see some of the highlights of the fund on your screen, but really saying, if we're going to truly tackle social determinants, we're really going to tackle the housing issues that we're seeing, we have to remove as many barriers as possible. And this product allows us to do that. The great thing about this product is that it can be layered with all of those traditional housing tools that many of us are familiar with and utilize on a day-to-day basis. This is a tool to enhance, not to be a replacement, not to create an additional barrier or additional layer of difficulty in getting housing projects over the threshold, but really a tool that we saw there was a gap and a need. And what we really are excited about is that every project that goes through this tool is actually assessed for its health impact. So not just the financial feasibility of the project, but how is this project able to impact community health, physical health, environmental health? What is the health impact on these projects? And every project is giving a score, and that is given consideration the same way as a financial package would in moving these projects forward. And so, the capacity building to have the vision and foresight to be able to create new products, where it's needed, and be able to think through how we layer that with traditional product has been a really great exercise for us in just building our knowledge and our scale and our scope of work. Next slide, please. The other capacity building opportunity that we had in the housing space was really what partners are coming to the table with us on these projects. And so it wasn't just enough for ProMedica to say, we are single-handedly going to create housing in Toledo in this pilot area. It's just not efficient. We are not the whole experts in this space. And so really trying to partner with folks that were already in the housing space. So when you think of the Housing Authority, the City of Toledo, LISC Toledo office, so folks that are traditionally experts and have expertise in-house on this space, but also who are non-traditional partners that maybe don't get consulted on the development or rehab end of a housing deal. So some examples here, so St. Paul, which is a homeless shelter in the neighborhood, but also a recipient of county dollars around mental health and homelessness, city dollars around ESG. They are a primitive supportive housing provider. Toledo and Lucas County have just adopted a housing first model to alleviate homelessness. And so what does that look like for agencies on the ground, and what is the need there? The Hospital Council of Northwest Ohio, which is a collaboration of hospital systems and healthcare partners, and what are really the health needs that we're seeing. So for ProMedica, in our 30-state footprint, that includes post-acute opportunities. So as folks are coming out of long-term rehab facilities and nursing facilities, where are they living? What kind of product is needed? Where are folks going? And then we'll talk a little bit about a project that we have upcoming. But for us, it was really important to have the right development partner. And so how are we talking with both for-profit developers, LIHTC developers that really understand what it is to come into communities and neighborhoods and create product that just do not financially pan out, but are also meeting the needs of the community. Next slide. So through all of this kind of capacity building and exercises and due diligence and partnerships, we were really able to develop a list of housing priority areas. And so you'll see those listed on the screen. So the loan pool, the health scoring matrix, which I talked a little bit about, workforce housing, as we decided LIHTC was not necessarily our first foray into the housing space, and that workforce housing would be a better option for us. How do you get those numbers to work? How do you get those performance to work? And a couple of priority projects in that space that we wanted to lift up. But it was also important for us because we knew that we already had existing LIHTC, that we already had existing affordable properties in this neighborhood space. How do we help those owners preserve affordability and help those residents stay in those spaces? So as a healthcare system, when you take a priority list that looks like this to your committees and to your boards, we're also telling a story that internally forces us to bring folks along with us. This traditionally does not look like a priority list that would go before a health system board, but our board had made the commitment to social determinants, and they've been doing a really great job in going through these capacity building exercises with us, with learning alongside the on-the-ground social determinants team, so that we can put forth plans of this nature and say, this is why it's really important for us to invest in housing opportunity and housing projects. And this is the ability that we have to tie it back to health. And these are the outcomes that we expect to see. And so we're really, creating a roadmap for ourselves within the social determinant space that is forcing everyone to think a little bit differently, to act a little bit differently, to deploy resources a little bit differently. But it's a commitment that we've made both to the community, to our employees, to say, this is a path that we're going on, and we want to be very transparent about the why and the how. And community, we want you to come alongside us and help us accomplish these goals, many of which overlap the mission and goals that you have for your organizations already. Next slide, please. And so part of that, where we get to, is a project that we are working for now. So if you look at the site map, you'll see Madison Avenue and the proposed housing development there. What's really important is that on the opposite side of Madison Avenue is eBide Center, the center that we talked about at the beginning of the presentation. And so as you really think about creating density, creating opportunity, creating access to goods and services for folks. Where we place projects is also important. And so this project is one that we've been working on over the last year. So workforce mixed use mixed income workforce development project that does not have a LIHTC component, and utilizing opportunity zones, utilizing hospital investment, utilizing city and county resources, utilizing private dollars to really create a capital stack that allows us to create these 195 units. And so I will say it has not been easy. The numbers are tight. We are having to think really diligently about how this comes together, but an example of a commitment that we've made to a community. And so as we continue to move this forward, we really lift it up to so many of our healthcare partners who are also thinking about housing investment to say, let's build some best practices around LIHTC, around mixed income, around workforce housing that other folks in the community can come alongside us on, that we can continue to use to advocate for social determinants, to create interventions and opportunities for folks to address social determinants, and really be thoughtful about how health outcomes can be improved by these types of projects. Next slide, please. The last space for us to really think about our capacity building is industry innovations. As I mentioned, there are a number of healthcare systems and organizations that are thinking very similarly about this health and housing space and how they can contribute and be part of this such important work. And so just one example to lift up, and this is a recent publication just in the last month with the Center for Active Design and the Kresge Foundation, which highlights 6 healthcare systems and the work that they're doing around housing investment, both on the new construction and development side as well as the preservation side. And so, for folks in the healthcare space, being familiar with what our colleagues are doing, but also for those that maybe not in the healthcare space, but looking for opportunities to partner and come alongside, being really familiar with what hospital systems are looking for and hoping to achieve so that we can build the strongest partnerships possible. And so really taking time to understand what other industry partners are doing. So the same way that we are helping to create content for this in the healthcare space, we're taking the time to read about what folks on the construction end are doing, what community-based organizations are doing, what developers are doing, and really trying to build not just the expertise, but also the partnership bubble to get things completed. And so that's been our journey around capacity building and housing. And so I will turn it over to Kelly to kind of continue the conversation. But thank you for the opportunity to tell you a little bit about the work that we're doing, and look forward to questions at the end.
Great, thank you, Kendra, and I appreciate your perspective and being able to give an overview of the social determinants of health and how that obviously plays a role in housing and the incredible work that ProMedica is doing. I know I can speak for, I'm sure, lots of smaller community-based nonprofits that we really value the impact and the reach that you have and really making a difference in this space. I look forward to building on what Kendra has talked about and really speak more so from a smaller nonprofit community-based organization who also looking at other strategies and other on-the-ground strategies of how we can build housing capacity in the under-resourced communities that we serve. Next slide, please. So I'm going to be talking briefly about 4 strategies that that National Health Foundation has utilized within the communities that we serve. The first being just how do we leverage the existing investments that already exist within the communities, how we can support community activism as nonprofits on the ground working with them. Is it possible and can we redefine partnerships that we may already have to be able to build housing capacity? And finally, recognizing and understanding the true root of the issue, which is recognizing that housing is a racial justice issue. Next slide, please. So looking at leveraging existing investments, addressing the social determinants of health has really become a critical focus, obviously, for health care systems and hospitals across the country. However, research has shown over and over again that while hospitals and health systems oftentimes are talking more about and understanding the value of the social determinants of health, they still continue, or many of them do, to struggle on how to really address those needs for their patients, and for their communities. Charitable giving through hospital community benefits, for example, can be used as strategic investments to target and improve social determinants of health, but it really does require a methodological and an in-depth approach beyond the traditional community needs assessment, which hospitals, or at least nonprofit hospitals, are required to do every few years. There are multiple strategies for community benefit grant making, of course, but the most effective one that we know that works the best are the approaches that are focused on engaging the actual population that they serve, and the population that stands to benefit from the philanthropy, and where they're making their investments. To be successful, then, of course, in this regard, hospitals need to pair that CHNA, that community health needs assessment process, with a methodological approach to engage that target population, understand the community barriers that exist, and to take stock in the community-based organizations and other resources that are already existing in that community. So, National Health Foundation has had the privilege of working with several hospitals to do just that, and we have worked with them and in tandem with their CHNA to produce community environmental scans for each of those hospitals. That is used, like I said, in tandem with that CHNA to develop and support better community benefit efforts, some of which, of course, are housing. Can we go to the next slide, please? So these community environmental scans allow hospitals and health plans to look at what resources they have, to look at the resources that already exist within the community, and see how they can better leverage those resources to have the larger impact. So while oftentimes the CHNAs that exist look at overarching data that already exists, it fails to go really into the community and find out what the community needs and what resources already exist. So it really doesn't take the place of the CHNA, but instead augments it or supplements it. So how do we do this? What was the process that took place? We really did look at the existing literature and did data mining. We did community engagement activities, and we really engaged with activities that were already existing within the community, where we could go in and actually speak to people, do community canvassing, do some focus groups and some stakeholder surveys, but not in the traditional sense, more so taking advantage of the community activities that were already existing. Then we were able to analyze that data along with the existing data and come up with recommendations and strategies for the hospitals that looked at addressing the social determinants of health, and also how they could utilize what was already existing in the community and build on that. Next slide, please. So supporting community activism is obviously, and Kendra spoke a lot about this, is obviously a great way for us to build capacity and housing capacity within our communities. NHF's approach to coalescing and energizing local resident leaders to tackle health inequities is an organic combination, really, of community-based participatory research and also community organizing. NHF's we first and foremost acknowledge the fact that the community residents and those that are most affected by the harmful systems and environmental conditions need to be the most active in defining the problems and shaping the solutions. And so our approach really is to put them at the forefront of the process. We feel very strongly that we do not empower communities. The communities are already empowered, that we are simply bringing in resources to allow them to resolve the issues on their own and to identify what those issues are. Next slide, please. So how does that process work within the community? Initially, NHF works to understand the community context and identifies the historical barriers to healthy living. Then once we have that holistic picture of the community, we'll facilitate the mobilization of the community residents interested in addressing those barriers. Our role, really, like I'd said before, is to facilitate these resident leader groups to build the capacity among its group members. We don't empower. We, of course, just provide resources. We host monthly meetings, often sometimes more weekly meetings, for them to collaborate. We bring in those resources and those other community partners that are doing the exact same work. And then from there, the resident leader groups can come up with their own action plan that includes both short and long-term goals, and then they work to accomplish that action plan. And Pico Union, for example, for in Los Angeles, this was very very much came alive for us as we opened our recuperative care center there in Los Angeles, which is a 62-bed recuperative care program for individuals experiencing homelessness that we opened in the middle of a residential community in Los Angeles. And it was through the community group that we were able to get the support needed, bring the partnerships in. It created jobs in the community, and obviously is providing housing options and solutions for those we serve. But it was the community group that really lifted this project up and allowed it to take place, particularly in a community, in a city where homelessness is such a crisis. The NIMBYism is quite strong where we are. So without this community group, I can honestly say that this program would not have opened and certainly would not be thriving. Next slide, please. So when we look at the programs that we serve and that we provide and the partnerships that we have, it's very important, and one very good strategy for building capacity is looking at those partnerships and saying, how can we redefine them, and how can we work with partners that are quite a bit larger than us oftentimes when we're small nonprofits, and be able to access and have access to their resources and help each other. And I'm speaking specifically for National Health Foundation when it comes to working with very large health plans and hospital systems who oftentimes have the resources and have the same goal, but it may be defined or looking at it a little bit differently, but the reality is it is the same goal. So the first thing we need to do is really to identify that we do have a common goal. And while we might be tackling it from different angles, we really are trying to accomplish the same thing. And housing is a great example of that. Housing is absolutely health. And for hospitals and health plans to be able to provide the services they need to provide, providing housing or having access to housing is one of the best ways to be able to do that for their patients. So being able to redefine the goal and recognize that we're on the same team and that we're trying to accomplish the same thing. It's important for nonprofits, particularly those that are community-based, to understand that big health systems and hospitals have limitations. That there's tremendous bureaucracy that exists within their systems, and that we can't just magically ask them to erase it or to move past it, and then get frustrated when they can't. We have to recognize that we oftentimes are much more nimble and quicker to react because we are smaller, and that we have to appreciate and respect the limitations that those bureaucracies have. We have to also be willing to contribute. We cannot come to the table expecting that because they are big and mighty and oftentimes have more resources that we should not have to contribute any. It's important that we also contribute. Sometimes those resources can look different. They can be different, but we have to be willing to provide those resources. I have to be respectful of time, obviously, knowing that the people that we're working with have a lot on their plate like we do. And we need to, what I talked about, willing to contribute above. We need to look for and identify opportunities for recognition. That's one way that nonprofits oftentimes that we can lift up the partnerships that we have with these larger organizations that have the resources, looking for opportunities for them to be acknowledged in the community with community awards. It could be on social media. It could be, with our legislators. But how can we work to celebrate those partnerships so that we can get our partners the recognition they deserve for their contributions? Also, we should not be closed to hiring or engaging a consultant. When we are working with several health plans to fund our recuperative care center that I spoke about before, and having health plans lease capacity in that shelter, and we had to hire a consultant to be able to work with those health plans, because oftentimes when we go to our first bullet here, identifying the common goal, when you have a consultant that really works on both sides, they can bridge that gap or help bridge that gap, open those doors for you, get those meetings that you need so that you can do all of this good work. So do not be closed to hiring a consultant to help you do that. And then, as always, it's so important to be flexible and really look at the needs of your partner, because through being flexible, we can really maximize the resources of everyone. Next slide, please. I think we would be missing the larger point of everything that we're talking about if we don't recognize that housing is absolutely a social justice issue. We know that social determinants of health are housing being one of the larger social determinants of health. And if you look at it very basically, we can say that obviously if we have enough housing for everyone, that we would eliminate the problem. And of course, that is absolutely true. But when we look at why the problem exists to begin with, we would be remiss if we did not recognize that housing is a social justice issue, and it is the primary means of wealth building, and the discrimination that exists in the institutional racism that exists in our country that we're built on is really why we have this issue in the first place. So we look at things like predatory lending and redlining. We know that there are historical reasons why we have this issue. So as we tackle this issue and looking at capacity building, one of the ways that as nonprofits or smaller nonprofits that we can continue to push this work forward is to insert this language into our discussions and into our partnerships, and really educating those that we work with as to what the real root cause of this problem is, so that as we move forward, we can look at the only real way to change this, which is through policy, and how can we have policy changes discussed and implemented that will also further the capacity. Next slide, please. And that is it. Thank you very much.
Thank you so much, Kelly and Kendra. That was wonderful information, and I can tell that there's a lot of interest from folks on the line because I've seen the chat box start to populate with questions. So I know we have about 15 minutes to get through a couple of questions. Just as a reminder, please add your question to the chat box, and I will be able to see it and can ask it to either or both presenters. So I'm just going to start with the first one. And this, I think, is intended more for Kendra. Kendra, what was the funding stream hospitals are using to contribute to housing as part of the social determinants of health?
So I think it varies by hospital system. For us, it's twofold. So we have this eBite Neighborhood Promise, so 10-year, $50 million initiative. And so part of those funds are able to be invested into housing work, and is actually the source that we're using to invest in that specific housing project that I showed the site plan for. But we are also able to do this through our CDFI fund, so the Health Impact Fund, which is $25 million committed directly from the system. And then, of course, as Kelly mentioned, really examining our community benefit opportunities to see what our options are there. So it really varies depending on the market that we're in the amount and some return on investment factors. But I think hospital systems are now starting to think outside the box about where those funds do come from and where we're able to utilize them.
Great, thanks, Kendra. Kelly, do you have anything to add on that piece?
I think she got it perfectly.
Okay, perfect. The next question says, thank you for a great presentation. Your focus is on a community of 1,900 people. Given that our hospitals may serve tens of thousands of low-income people, how do you see scaling this type of work?
So it is just the pilot neighborhood, that is 1,900, but we work on larger scales every day. As I said, we have a 30-state footprint, and so we are in everywhere from large urban centers to small rural communities. I think the space is really about partnerships and leveraging dollars. So when you have major metros and populations that just far exceed that 1900, what partnerships at the table are helping you leverage other dollars besides healthcare dollars? And also, how are we best utilizing? And so, for us, it's a mix, right? There has to be a mix of grant work. There has to be a mix of investment. There has to be a mix of dispersing loans. And so, one of the things that we talk about a lot in the community is that I would say you'd be hard pressed, obviously, to find a healthcare system that has enough dollars to solve the social determinants work that your community is doing. And so we're asking other folks to come to the table and leverage. So our banking partners, our for-profit partners, other nonprofit partners, how are you utilizing your operational dollars to create these pools? Whether you want to do that through grants or investments, this is about leveraging resources, and healthcare is just one partner in that. But regardless, if you are a large population or small, it's really partnerships and leveraging dollars and figuring out where you want or need your return to be able to continue this work in a sustainable manner.
Great. Thanks, Kendra. I think this question is probably for Kelly. When you're using community-based participatory research, are the community members getting paid?
That is a great question. Oh my gosh. And I also would like to piggyback a little bit on what Kendra spoke of before. And actually, I can put it all together. We have 2 community action groups right now, and neither of them are being paid currently. However, we recognize that is needed, because in the same way that we are working towards this effort, if the community members they should also have stipends. So we were just approved for a grant to work with LA Care is the largest Medi-Cal health plan, if not in the country, this side of the Mississippi, and we are working with them. They are creating 14 community resource centers around Los Angeles, and they've just approved for us to create a community leadership group at each of those 14. And as part of that grant application, we actually put in stipends for the community leaders, and we identify hoping to have at least 10 community leaders at each of those community resource centers, and there will be stipends for them. We also have at our other 2, although they're not paid, we do give them participatory budgets, and so they each get a $50,000 a year budget that they utilize to create, to identify issues and then to try to build programs in their communities. But the paying part is something, it's funny that you say that. We just started looking at that and added that into that grant application for that exact reason.
Super, thanks. That's a helpful response. Another question, I'll just read it, is in its entirety. Housing has not been traditionally a part of healthcare, and it is an industry that has many demands. How are these new projects planning for management and sustainability?
Mm-hmm. So I think, and I can only speak definitively for ProMedica, but what I think that you will find is that most healthcare systems are actually, one, not the developer of the project, probably are not managing the project. And so, again, partnerships. So for us, we have a development partner in our housing project who is responsible the same way any other project would come on board for identifying their management partners, the same way they would do their architects, their builders, their subs, all of that. So while we are making financial investments, for us as ProMedica, we actually don't have ownership stake in this specific project, and therefore are finding, right, part of our job is to find the right developers that understand the context and needs of the community in a more in-depth way than, some traditional process would allow, and then really having a good conversation. So for example, with this project, mixed income, mixed use, having a conversation with their management team about what does that mean? What are we allowing, right? So as you think about conversations in the housing industry about criminal past and what that looks like in rental housing, as you think about sources of income, as you're thinking about all of these conversations that are happening in the housing space, we don't want our projects to deviate in process necessarily than any other housing development, but it's about being intentional on the front end and providing non-traditional capital to get them over the threshold. So most projects, I think you would find, have a traditional management development partner owner landscape, just like any other project would have.
Super. Thanks, Kendra. One more question for you. Are you considering any sorts of innovative pay for success models that would be based on areas where there are significant savings to the health system?
Yeah, I mean, I think that, there's always models to be had. One of the things about the social determinant work is that it is so intricate. And so we don't have anything definite in that space yet, but definitely something that is always part of the conversation as we continue to figure out the best way to show success and make the link that these types of investments do work.
Super. Thank you so much. I think that's all of the questions in the chat box. I want to remind everybody that we will continue this conversation via Forum B. It's a very easy to navigate site. There are tabs for both the food insecurity and housing insecurity cohorts. You'll have access to both. Please continue to engage there, post questions, links, comments, thoughts, etc. And reach out if you have any questions about using it. I also want to thank today's presenters. The information was really fantastic, and they will be engaged on the forum site over the next month or so. As a final wrap-up, just a reminder to fill out the survey that's coming your way, and thank you again for participating. I'm going to give you 9 minutes back. Thanks again.
Thanks, everyone.
Thanks, everyone.
Bye-bye.